Good afternoon, and thanks for joining us for today's Healthline 3. I'm Courtney Butts. Healthline 3 is a 30-minute conversation where we like to focus on ways to help you live a healthier, happier, and pain-free life. We'll also be taking your calls, and if you have any questions, you have the chance to call in and ask those live in the studio today. We'll be opening those phone lines around 12:05, so in just a couple of minutes. But as a reminder, make sure that you are in a quiet room when you do call with your TV turned all the way down so that we can hear your question. That number is 318-219-4569. It'll also be on your TV screen at the bottom when those phone lines are open. And joining us today is Irina Haskatas and Catherine Schaefer with Shed It Weight Loss and Wellness. Love to have you guys as always. Thanks for being here.
Well, thank you.
Absolutely. So this is end of summer, kind of. I mean, we still technically have like a month
still feels
left.
like summer.
Technically still have a month left according to our meteorologist, right? September 21st is kind of when the fall officially kicks off, but always when kids go back to school, there's this natural shift of getting back into routine, not going on vacation as much. And so I'm sure you guys see a shift in that as well in your practice.
Oh yeah, now is the time that especially women want to get to themselves. Like self-care is a big focus right now. You have all these back to school specials, which what we do too.
Okay.
And we can talk about that a little later.
Yeah.
Yeah, but now is the time to get back on the wagon if you fell off.
Right, and it's easy to do when you're on vacation.
It's very easy if you want to enjoy.
Yeah, you're exposed to maybe more high calorie things, high fatty things that you just don't typically would have in your routine.
I mean, you also should splurge when you're on vacation. Yeah. But now it's time to get back on track, and we're here to help.
Absolutely. Okay, so with Shed It, your focus is those GLP-1 medications. Yes. And we've heard this kind of a buzzword the last several years. But Catherine, can you give us the background of these medications since you're the physician assistant, kind of have that background with it?
Yeah, so this is that whole GLP class of medicine. These have been around for a long time. They were initially used for diabetics. They are basically working on, it's a glucagon-like peptide or GLP receptor on your pancreas. They're helping your body better regulate your blood sugar, produce more insulin, become more insulin sensitive, if we have insulin resistance and conditions like that. So again, they're not new. They are newer for weight loss in the last couple of years because they found that they also help with that hunger hormone. So just kind of help us, have less cravings, less of that constant thinking about food. And then they can slow stomach and GI motility. Basically, it helps you to feel fuller sooner and longer. Medical term or terminology for that is delayed gastric emptying. But basically, things can just be slower to move through your GI tract. So comes with some side effects there, which we would always discuss, but helps you just feel a little fuller, helps you have less cravings, and then it is better regulating your blood sugar. So people see weight loss benefits kind of from that trifecta of how it works.
Yeah, and the interesting thing is when these medications came about, it was to treat diabetes, right? And then we saw weight loss as a side effect, and so that's why we're kind of seeing this surge
shift into
Yeah, okay, and so you guys, a lot of times what people probably think of is semaglutide and tirzepatide, but there's a third one now, and this one is relatively new in your practice as well. So can you tell us about that one?
Yes, we are recently offering retatrutide. That is another of those GLPs. I like to categorize them. So semaglutide, which is like your Ozempic or Wegovy, is going to work on, it's like we call it GLP-1. It's going to work on one of those GLP receptors. The tirzepatide, which is your Mounjaro Zepbound, actually is going to work on two of those receptors. And then retatrutide, which is the newest, kind of latest, greatest, is working on three receptors. So it's also working on that hunger hormone glucagon. So really, really helping with, the food noise, appetite suppression, just kind of overall how everything is working. So again, it's still pretty new, but I expect we'll see more and more out of it as everything comes out.
Okay, and I guess the thought is the more receptors that it's working on, the more weight loss you could stand to potentially see.
Yeah,
right?
I think it just makes them a little bit more efficient, and then people just get more benefit from them.
Okay, and so, and who is a good candidate for all three? If you're a good candidate for one, are you a good candidate for all three?
Typically, yes. Everybody's different. Sometimes people might have a side effect with one and then tolerate another one better, so that is more of a trial and error thing. There's a couple of categories that make people not a candidate for the injections. that being medullary thyroid cancer or multiple endocrine neoplasia syndrome type 2. Those are the two main contraindications for the injections. But basically, if you were a candidate for one, you could do all three. People tolerate them differently, and people get different results with different ones. So that is sometimes, like I said, we sit down, talk about your dose, and then see kind of how people do.
Right. Yeah, and that's a good point that people tolerate it differently. We've talked about this. I had a patient who she's prone to migraines, and with even the smallest dose, it was kind of triggering this migraine. But there's a way to even kind of split up the dose if you're maybe not tolerating it to see if that will help. If you want to talk about that.
Yeah, so month to month we have your dose that you're on. The injections are once a week. It is a sub-Q injection, so it's an easy little just kind of underneath the skin or fatty tissue injection. But if people are having side effects, sometimes people get a lot of nausea the day of, or they can get some indigestion or migraine, things like that. So we can actually divide your dose into 2 different doses. So instead of doing it just the once a week, day 7, we have people do it on like day 1 and then day 4 or so.
Okay.
And so that way you're getting the same amount within the week's span, but you are splitting it so that, just a little less at a time. The total result is the same at the end of the week.
Yeah.
But then if, like you said, if that was triggering a migraine, and even just splitting that dose or halving that dose can help to avoid some of those side effects and triggers.
Yeah, and the patient I was referring to, she ended up going to the full dose once a week and no issues at that point. So that's a good thing to know, that if you are having these side effects, there are ways around it. In some cases, of course, if it's not improving, then you may need to talk about switching medications to one that you would tolerate. So.
Yeah, and I think this is also this huge benefit when you have somebody like Catherine you can go to, you can write an email or send a text message if there is questions, and we will get right back. And it's not that you get it from a more or less anonymous company through the internet.
Right. Yeah. So you have that support for sure. So with these medications, tell us about those results that you guys see from your patients.
It's really amazing. Like, it's not only the weight loss, it's plethora of great side effects, I would say. Like people that get off blood pressure medications, which includes my own mom. And the A1C going lower, much lower, that they don't need their other medications anymore. And just overall better sleep, feeling better, more energetic. There is patients that lost more than 100 pounds. Like, you wouldn't even recognize them anymore. Like, it's life-changing, life-transforming, and so rewarding for us.
Yeah.
So
I love that, and I love that you also emphasize life after the shot, I guess, and emphasizing the importance of the lifestyle component.
Yes.
That you're not just using these medications just to lose that weight. You're also implementing these other strategies.
Yes. So we take this exit strategy really, really seriously, because this is what makes or breaks it. Like, almost everybody will be able to lose the weight, but we want to keep it off.
Right.
Like, sustainability is the key, because you want to stay healthy. Like, once you reach that goal, you want to keep that goal.
Yeah.
And this is why we have several our exit strategies, several plans. We work with every individual, what works best for them, and set them up for success.
Okay, awesome. So like you said, it's usually not a matter of if, but when you're going to lose the weight on these medications, unless there's some people that maybe just don't respond well to them. I feel like that's somewhat rare, but anyways, that's something that you will talk about in your sessions with them. But what is something, if somebody is still on the fence of taking these shots, can you give someone a realistic measure of how much weight that they could lose? I mean, of course it determines on where you start, right?
Yeah. Like you said, that's kind of individual. Some of it depends on how much weight we need to lose, sort of our baseline, kind of what our diet looks like before, our exercise level. I would say on average, people lose 4 to 10 pounds a month. I would say anywhere from 1 to 2 pounds a week is going to be your safest, most sustainable weight loss. Just, I know everybody wants to lose weight just as fast as possible. But as far as being sustainable, not messing up your metabolism down the road, and then your body not, overcompensating or undercompensating, I think that 1 to 2 pound a week mark is safe. Now, I mean, there's certainly people that, you know, first, second month on the injections, especially if we are very overweight or, you know, we haven't really been, you know, eating well or things like that. You know, I've seen people lose 15, 20 pounds in a month. Some of that's water weight, some of that's some inflammation and stuff too. But we also at that first visit sit down and really discuss, you know, things like protein, fiber, water, you know, kind of the basics. But you'd be surprised at just, you know, just kind of, I guess, the lack of knowledge overall. And so, you know, people that come in and say, I feel terrible, and then you sort of dive into, you know, how they're eating or, you know, how much exercise or not exercise they're getting. And then, you know, we really try to have the medication as a tool, but, you know, in conjunction with other things as far as just trying to, you know, eat better, eat more whole foods, eat kind of just more sustainably. And then people really do well as far as weight loss month to month.
Okay, and I've also heard some people say, and you can correct me since you kind of are a little bit more of the expert of how these medications work in the patients that you work with, but is there a window where you see it takes a second for these medications to kind of, for lack of a better word, but kick in? Like, do you have to kind of adjust to these medications for a couple of weeks, or can you start to see those results almost immediately?
I would say most people see result relatively quickly, but we start everybody at the lowest dose. So, you know, there's that starting dose, just because, you know, like I said earlier, it can slow that GI system. There are side effects and risks associated with it. So we can't just jump in and throw, you know, a high dose at you. We have to start low. And so there are definitely some patients, you know, who that first month kind of notice a difference. They might even notice, you know, they're down a pant size, but they haven't lost a lot of weight yet. And so that does take just titrating that dose or getting, you know, to a higher dose, or just time, you know, and some consistency there too. And so, you know, that's hard to say. Most people do, you know, after the first month see some result, but there's definitely some patients that we do need to, you know, increase that or titrate that or get to a more therapeutic level there.
Right. Okay. So even more than weight loss, we've kind of mentioned some of those non-scale victories, and I think you mentioned some with even your mom as well. But what are some of those other health benefits that aren't just associated with that number?
It's really sleep and energy levels.
Yeah, I
I
would
think
say
this
sleep,
is the number
energy. You know, I've had patients that needed knee surgery, and then, you know, their doctor said they had to be under a certain level to have it, and then, you know, they were able to have something like that. Less medications. You know, obviously we have you also talk to your primary care doctor, but, you know, the number of people that have been able to decrease or come off of a cholesterol or a blood pressure medicine. You know, your pants fitting better makes people feel better overall. Some people's goal is just to, confidence. Some people's goal is, you know, to get off the floor with the grandkids, and then they come in and say, yeah, now I'm chasing them around and beating them, you know. So there's all kind of different, you know, benefits to weight loss besides just the aesthetic part of it. So
right, and we talk a lot about the inflammation that these drugs help to decrease in patients, which inflammation can lead to a slew of course, joint pain, but then also diabetes or heart disease or even cancer. So, you know, what are some of those things that you've seen that for patients who feel like they're actually preventing these diseases? You know, like what are those links to these chronic diseases in these drugs?
Yeah, like you said, kind of inflammation is going to be that starting point for so many of those things. We have several patients with, you know, rheumatoid arthritis or some of those conditions that will just stay on that micro dose. That's just kind of that lowest dose, and they might, you know, do that once every week or once even every other week, just a super low dose, but they just kind of notice less, you know, joint pain, less inflammation there. And so, you know, it's not necessarily getting them off of their like biologic agents for RA, but it definitely is just controlling their day-to-day, just kind of their quality of life.
Right.
So, you know, I mean, we've got that. We've got people who were pre-diabetic that are no longer in that range. You know, before we cross that threshold from pre-diabetes to diabetes, and people really want to put their foot down and not, you know, get labeled as diabetic. And so it helps to reverse that. I would say overall just kind of quality of life definitely helps, you know, just kind of getting inflammation and getting that insulin resistance under control.
Right, okay. And also you have other things not related to the shot that you offer at Shedit, specifically the Gallery cancer test. And so there's that clear link between weight or excess weight and the inflammation and maybe cancer risk.
Yes.
So Tell us a little bit about that tool.
Yes, so there is a link of obesity towards cancer. So since we see ourselves as a more holistic clinic, I guess we offer the Gallery Multi-Cancer Early Detection Test, which is a blood test, and it detects more than 50 cancers that have no screening.
Right.
And yeah, the reason why we offer that is because, first of all, Dr. Gaddis, who's also owner of the clinic, is an oncologist, and he's very passionate, of course, and he knows that the earlier you find it, the higher your chances are of survival or better outcome. So the way that works is the cancer sheds its DNA into your blood, so you can detect it way earlier than if you already have symptoms somewhere.
Right.
And of course, with some cancers, you don't even have symptoms until stage 4.
Yeah.
So it's really key to find it as early as possible. So we offer that in the clinic. Unfortunately, it is not covered by insurance right now, and it's really expensive. It's $949, and they recommended to do it every year because, of course,
Right.
you know, it can always
Metabolic
happen.
and cell damage, and okay. Dr. Gaddis, we have him on our Healthline as well, and so some of our viewers may know who that is. So he's the one that kind of looking at that screening and maybe
Correct.
following up.
Yeah.
Okay.
So it will actually be reviewed by him.
Right.
Yeah.
Right. Okay. And so do you have any recommendations on when someone should start a screening like that, or is there a certain age?
Yeah, like typically they recommend 50 years or older because this is when the occurrence just increases, or if somebody has a family history. So I do it, although I'm just a little over 40, but there is a history of breast cancer in my family.
Right.
So I started doing it, I think 2 years ago. Yeah, and it just gives me peace of mind. You know, of course, there is no this 100% right ever. I mean, there might be a false negative, but at least I tried it, and I can never say I did not do it. Yeah.
Okay, very cool. Yeah, so that's something that they can just call in and figure out if that's something that
it's like
works
a
for them.
little like a kit, and you go to a blood test place, and then they send it off for you, and it takes about maybe 7 business days, and it comes back to our portal, and then we see the results.
Very cool.
It's really straightforward.
Yes. Well, that's awesome. So if you're just joining us and you have maybe a question for Irina or Catherine, we are talking about weight loss and wellness, the GLP-1 medications as well, and anything specific to this topic, give us a call. That number is 318-219-4569, and it's right there on your screen. If you didn't get a chance to write that down, don't worry, it's right there on your screen. You can give us a call. So with these medications, going back to kind of the GLP-1s, these are the injections, but you also have a pill form, right? Is that something that is still offered?
It's like a sublingual drop.
Okay.
It's not a pill. It's like it's a solution. We still offer it, but there is basically no demand, which is kind of surprising because there is people that don't like needles.
Right.
But I feel like the results of the injections, they speak for themselves, and there is more experience now. So we really have not that many people that are interested in it.
Okay.
So that means we also don't have much data how it works compared to the injections.
Right.
But we still do offer it. Like if there's somebody out there that would want the drops, like we can still get them.
Do you feel like a lot of people maybe are scared of the needle and then kind of get over that fear too? Yeah.
Because it's really, I mean, I hate needles myself. It's kind of funny enough that I ended up in this clinic, but it's really this itty bitty 31G insulin needle, and it's really so tiny, 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 you don't even feel a prick. And it also doesn't go into the muscle, like for instance, a flu shot or whatever. So you really don't feel it. Like it goes here in this fatty tissue.
So you're not going to get like a bruise like you would maybe from the flu shot?
No,
they're pretty easy. We also have patients that don't like needles, and so most of those come in weekly, and our medical assistant will just give them their injection so that they don't have to give it to themselves.
Yeah, that is also a service we offer, like free of charge.
Oh,
like
nice.
if patients do not feel comfortable injecting themselves, they can come once a week for free, and
then they get to weigh and kind of be more accountable. You know, they get to see our faces once a week instead of once a month.
Yeah, and I think that would be even if you weren't. You know, if you didn't love needles, it's kind of like a nice way to stay up to date and accountable. As well. So that's great. I love that. So is there a specific patient, I'm sure there's many that you have in your clinic, that just stands out to you that you wanted to maybe highlight today? We of course don't have to share names or anything, but just a specific testimonial story. It could be any of them. that you want to share?
Yeah, I mean, I see them all day long.
Yeah.
You know, specifically, there was a lady, and she came in on several different blood pressure medicines. She was probably like 65. She was also had gone through menopause and was really, you know, said she had just tried everything. And so we ended up, you know, really sitting down. She only wanted to lose 30 or 40 pounds. You know, and like Irina was saying, we have people who've lost 100 pounds. We have people who come in because they only want to lose 15 or 20. So there's no one size fits all there. But she was just one of the first patients that I saw. I've been doing this 2 years now, and so, you know, I just kind of remember, you know, starting with her, and then we got, you know, weight off, and then we were able to wean totally off of the medication. And so, you know, she still has my phone number, so she'll call every now and then or text, you know, and just kind of keep in touch. But was able to get off of several of the blood pressure medicines. And, you know, that was just kind of one of my first success stories of just, you know, start to finish to getting off of the medicine, her feeling better, you know, her saying, you know, after trying everything, that was one of the ones that had, you know, just had finally stuck. And so now she's able to live life without a GLP. Some people really do need them long term. And some people don't. So that just kind of depends on, you know, people's level of, I think, health overall, insulin resistance, kind of things like that. And so I just, you know, will always remember her. So
I love that. And I love, I think one of the biggest compliments as being, you know, in the healthcare field is when patients can go forward and kind of conquer without the help from a clinic, you know, and that you did everything that you could to give them the knowledge that they need to feel empowered. And now they're, you know, she's out there doing her own thing.
Yeah, she spread her wings. That's right.
That's like the biggest compliment, because you did everything as a, you know, a healthcare professional to help her.
Yeah.
And now, you know, she's just kind of that walking testimony.
Yeah.
So that's cool. Love that. Yeah. So what about other patients that you see that maybe are frustrated and they feel stuck with where they're at? How do you kind of counsel those patients?
Yeah, so that happens often. You know, we really try to sit down and be sure that we're drinking correct amounts of water, you know, adequate fiber intake. Protein intake is a really big one. You know, we do have nutrition referral partners. I've referred people to you if we feel like we have people that are, you know, just kind of stuck and doing everything right and not seeing result. And a lot of times it comes down to just fine-tuning nutrition and things like that. You know, especially with the GLPs, but weight loss in general, protein is just going to be so important. And I don't think get enough of it. You know, I think there's just kind of I think the younger generation is super protein focused, but then kind of the generation above us, you know, just doesn't, you know how to add extra protein in different places. And so I think whenever we can fine tune some of that, and then exercise is another big one. You know, some people go to the gym, some people do that regularly, some people can't. Some people can't go out and walk 4 miles a day, you know, just joints limit that, or time. You know, I've got busy moms who are just like, yeah, I would love to go do that, but I just don't have the time right now. And so just, you know, even adding in kind of extra steps throughout your day, just any way to fine tune, kind of adding some extra exercise in. So it's kind of a long-winded answer, but just to say,
it's many different things.
Yeah, you know, sometimes it means adjusting the dose. Sometimes people just need a higher dose. Sometimes we need to switch. So, you know, some people, you know, semaglutide I think offers up to like 8% body weight, you know, promised of loss. And so we may need to switch to the tirzepatide or the retatrutide and try something different. But a lot of times if we can even just go in and fine tune, you know, that water, that fiber, that protein, and that exercise, then the next month we really do see, you know, new results. So
yeah, so kind of that's why those sessions coming in every month and checking in is so important, because if you just gave them the medication, never checked in, then they could get frustrated and not feel like they have that support.
I think there's also still this misconception that this medication is this miracle tool, but it's not. Like it's a medication, it's a tool, and it works. But that does not mean that it's this quick fix and you don't have to put any effort. Like that is just not true. Our best patients are really the ones that follow Catherine's advice regarding the nutrition, regarding the exercise, and then this is how you build the long-term success. And I think some people just don't want to see that. That it really, you have to put in some work yourself too.
Yeah, and so that you feel confident when you do eventually get off the medication. You want to be able, like we've said at the beginning, to maintain that. And that's something that you guys really heavily push, so that's important. And with patients that maybe lose weight too quickly, is that something that, well, obviously you're monitoring the weight, so, and weight can be, to you guys, it's like data, right? It's can really fine tune how you're going to move forward. And if there's too much or too quick of weight loss, what do you typically suggest from that point?
I mean, this is really where our Fit3D body scanner comes in, because this is how we can track the muscle versus the fat loss. So if somebody loses weight too quickly, it might be muscle loss, and we definitely don't want that at all. So this would need a huge adjustment, because then you really have to make sure that you get your protein in, and that maybe you even like decrease the dose, because maybe the dose you're on is too high for you. Because if you don't eat enough, that is exactly the opposite that we want to achieve.
Yeah, absolutely. Okay, and so on that vein, we have a couple of minutes left. You have the Fit3D body scanner, but you also talk a little bit about, I guess, the Fit3D body scanner for patients, or even people that aren't patients can have access to it, and these back to school specials.
So the back to school special that we offer right now, it's something new. We have not offered it before. It's like a bundle. We call it Energy and Immunity Boost, because I think this is what everybody needs right now. So it's a combination of a B12 shot, which gives you energy, and a D3 injection, vitamin D3, which helps your immunity, but also your bone health. So I think now that everybody gets in touch with a lot of other people, I think this is a perfect deal. And it's only $30 for both injections.
Nice.
And then we also have our Lean and Sexy package. It's $200, and it comes with 5 lipotropic injections. And these are, you can take these in addition to the GLP-1s. They have no stimulants. It's only a blend of vitamins and amino acids, and they help to shed weight a little faster. So especially here in this midsection, so you can tone a little. But the most important thing with this is you really have to stay hydrated, try to avoid fatty food, and preferably exercise.
Okay, good deal.
And it's $200 for 5 injections.
Nice. Okay, awesome. Yeah, so some great things. And let's say if somebody is interested in the medications, and the test, like the cancer test that you said wasn't covered by insurance, are the medications, the GLP-1s covered, or GLPs covered?
It depends. For patients who are diabetic, like that have a diagnosis, they can get the medications covered. So we would fill out a prior authorization, or Catherine would, then they can get it from the pharmacy.
Okay.
However, for patients that really only want to do it for weight loss and are not diabetic, then they have to pay out of pocket. But our injections start at $199 a month, which covers the visit with Catherine, for semaglutide injections and use of the Fit3D body scanner. And I think this is a really competitive, affordable price.
Oh yeah, for sure, yeah. And so yeah, with insurance, it just really depends. And sometimes even you do the prior authorization.
It's very difficult. I mean, of course, everybody wants to try it now, and it used to be easier. Like 2-3 years ago, it used to be much easier. Like in the beginning, I think even people that were pre-diabetic would get it, but they cracked down on that. So it's difficult right now.
And you guys offer most of the all the injections are compounded, right?
Correct. Okay. Yeah, this is the only way how you can
get it that cheap.
Get it at that price. Yes, get it that cheap. Yep.
Right. Yeah. Okay. Good deal. Well, we have 90 seconds left. So, if somebody's interested in anything that we mentioned today, what's the best way to get in contact with either of you?
Well, give us a call at 318-746-3880. Or just stop by at our clinic. You can always stop by, 2211 Shed Road in Bossier City, Suite B, that's the purple door. You can also start following us on Facebook or Instagram or TikTok. We have a lot of informative and fun content there. Our email address is info@sheddit.com. So if you cannot reach us by phone because maybe somebody is busy right now, but there's plenty of ways to get in touch with us.
Okay, and maybe leave a message if it's after hours or something, and you'll get.
We have a voicemail too. Yep.
Okay, yeah, and if you miss the number, you can just look up Shed It on Shed Road or Shed It Weight Loss and Wellness.
Yeah. If you Google it, you will find us for sure. Shed It, Bossier City. that's how you
Easy
find
enough.
us.
Yeah,
Easy
shed it
enough.
on Shedward. That's like the easiest thing. Shed. Yeah. So, anyways, thanks guys for joining us. Very informative session today. And if you missed this will be on our website. That's ktbs.com/podcast. And we also post these to Spotify as well. Thanks for joining us.